What would you do if you knew that getting screened for breast cancer mutations could save your life? If you have a family history of breast cancer or have developed early age onset breast cancer, it may be worth getting screened for possible mutations in your genome. Breast cancer can occur in both men and women, but it's far more common in women. Statistics show that 1 in every 8 females will develop it in their lifetime. Globally, breast cancer now represents 1 in 4 women with cancer. Patients with breast cancer are 2 to 5 times more likely to develop a secondary cancer in the contralateral breast than are unaffected women to develop an initial breast cancer. One is diagnosed with contralateral breast cancer after a second tumor grows in the opposite breast, within 6 months following the detection of the first cancer. The common symptoms of contralateral breast cancer include a breast lump or unusual thickening of the breast tissue. People may also have a change in the size, shape, or overall appearance of the breast. It is important to see a doctor if you find an abnormality in your breast, even if recent mammogram results came back normal. Overall, the cause of contralateral breast cancer is linked to heritable genetic mutations. These mutations can cause cancer cells to form, divide, and accumulate to form a mass in the breast area. The cancer itself may metastasize and spread throughout the breasts and other parts of the body, including the lymph nodes. The most common heritable breast cancer genes are BRCA1 and 2, both of which increase the risk of developing breast and ovarian cancer. However, there are other mutations besides the BRCA gene that increase the risk of developing contralateral breast cancer. Contralateral breast cancer is associated with a single nucleotide polymorphism, or SNP, where a single allele mutates. In some cases, this can have no effect on the body. However, in other cases, this point mutation can make a person more likely to develop a disease or affect their response to treatments. There's a specific SNP at the 2q35 locus on chromosome 2, specifically at the rs13387.042 location of the genome, that is associated with a high risk of contralateral breast cancer. In this case, there is a change of the thymine nucleotide at this position to either an adenine or guanine. In order to detect this SNP, a small blood sample can be taken from the patient. The DNA can then be extracted from the blood, and through the use of real-time PCR, the specific genotype can be determined. In real-time PCR, the DNA is mixed with probes coding for specific genotypes, coupled with a fluorescently labeled tag and a quencher. During the amplification process, the probe that corresponds to the genomic sequence binds to the DNA. When the tag and the quencher are attached to the probe, no signal is emitted. An enzyme, Taq polymerase, then digests the probe via a 5' to 3' exonuclease activity. The digestion of the probe separates the fluorescent tag from the quencher, which then emits a fluorescent signal. This signal is amplified as the DNA is replicated, and the threshold point of signal intensity is recorded on a computer. By looking at the real-time PCR graphs produced by the computer, the presence of the mutation can be determined by the fluorescence of the specific probes at the designated wavelength. Therefore, if there is a fluorescent amplification at a known wavelength for a probe, it is indicated that the mutation is present in the patient's DNA. This sensitive and efficient assay can help determine if you have an increased risk of developing contralateral breast cancer and if you are likely to be responsive to certain hormonal therapies. If you have a family history of breast cancer or have developed early age onset breast cancer, you should talk to your doctor about getting screened for the single nucleotide polymorphism at position rs13387.042 on chromosome 2 because of its association with the risk of developing CBC. Talk with your doctor today and make an informed decision about your plan of action.